Women's Daily Pack is a multivitamin product that is used to treat or prevent vitamin deficiency due to poor diet, certain illnesses, or during pregnancy. Vitamins are important building blocks of the body and help keep you in good health. It is recommended to take one pack daily with food, and it is best to take it at the same time every day to help you remember. Women's Daily Pack provides essential vitamins and minerals to support overall health and well-being, making it an important part of a woman's daily routine. When it comes to the Women's Daily Pack, it's important to take it by mouth, usually once a day or as directed by your doctor. Make sure to follow all the directions on the product package and avoid taking more than the recommended dosage. It's best to take this medication regularly at the same time each day to get the most benefit from it. If you have any questions, don't hesitate to ask your doctor or pharmacist. It's important to note that some common side effects of Women's Daily Pack may include constipation, diarrhea, or upset stomach. These effects are typically temporary and may go away as your body gets used to the medication. If any of these effects persist or worsen, it's important to consult your doctor or pharmacist. If your doctor has prescribed this medication for you, it's because they have determined that the benefits outweigh the potential risks of side effects. It's important to note that many people using this medication do not experience serious side effects. While a serious allergic reaction to this medication is rare, it's important to seek medical help immediately if you experience symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. Keep in mind that this is not a complete list of potential side effects, so it's important to consult your doctor or pharmacist if you notice any other effects not listed above. If you're in the US, you can call your doctor for medical advice about side effects, or report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report side effects to Health Canada at 1-866-234-2345. If the multivitamin you are taking contains iron, it is crucial to store it in a place that is not accessible to children. Accidental overdose of iron-containing products is a common cause of fatal poisoning in children under 6 years old. If an overdose does happen, seek medical assistance immediately or contact a poison control center. Before starting to take Women's Daily Pack, it's important to let your doctor or pharmacist know if you have any allergies to its ingredients, soy or peanuts. This product may also contain inactive elements that could cause allergic reactions, so it's essential to discuss with your pharmacist about your concerns. If you have a history of alcohol use, liver issues, or stomach/intestinal problems such as ulcers or colitis, be sure to inform your doctor or pharmacist before taking this medication. For those brands of multivitamins that contain folic acid, it's important to discuss with your doctor or pharmacist if you have a vitamin B12 deficiency, pernicious anemia, before using them. Folic acid may impact certain lab tests for vitamin B12 deficiency, potentially leading to serious nerve problems if left untreated. It's crucial to consult with your healthcare provider for more information. Before undergoing any surgical procedures, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or breastfeeding, it's important to discuss with your doctor before using Women's Daily Pack to ensure the safety of the medication for you and your baby. It's important to be aware of potential drug interactions with the Women's Daily Pack. Some medications may affect how the Women's Daily Pack works or increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. If your multivitamin contains iron, it's best to avoid taking it at the same time as antacids, bisphosphonates, levodopa, thyroid medications, or some antibiotics. Be sure to ask your doctor or pharmacist about how long you should wait between doses and for help finding a dosing schedule that works with all your medications. If your multivitamin contains folic acid, be sure to tell your doctor or pharmacist if you take certain anti-seizure drugs. Additionally, this medication may interfere with certain lab tests, so it's important to make sure lab personnel and all your doctors know you use this drug. If you suspect an overdose and the person is experiencing severe symptoms like passing out or difficulty breathing, it's crucial to call 911 immediately. Alternatively, you can also contact a poison control center for assistance. In the US, you can reach out to your local poison control center at 1-800-222-1222. Canadian residents can call their provincial poison control center. Symptoms of overdose may include stomach pain, nausea, vomiting, and diarrhea. It's important to seek help right away in case of an overdose. Remember to take Women's Daily Pack daily as directed. This product is designed to provide essential vitamins and minerals that may be missing from your regular diet. It is not a replacement for a healthy diet, so be sure to continue eating a well-balanced meal. It is best to take Women's Daily Pack with a meal to help with absorption. If you have any questions about the ingredients in your specific brand, don't hesitate to ask your doctor or pharmacist. Finally, be sure to keep all medical and lab appointments to monitor your health. If you forget to take a dose of the Women's Daily Pack according to the recommended schedule, take it as soon as you remember. If it's close to the time for your next dose, skip the missed dose and take the next dose at your usual time. Do not take double the dose to make up for the missed one. Remember to store the Women's Daily Pack at room temperature, away from light and moisture. It's important to keep it out of the bathroom and away from children and pets. When you no longer need the product or it has expired, make sure to dispose of it properly. You can consult your pharmacist or local waste disposal company for guidance on how to do this. And remember, don't flush the medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.